చప్పట్లతో busy schedules and everything. So out of their body. So the health education first. ఇప్పుడున్న కాలంలో మనకి చాలా అంటే చాలా but once again heart
special about Indians. Okay? So there's the Indian factor. So we eat mostly rice. It's a simple carbohydrate. Okay? So we're also less active than our ancestors. So our grandfather's generation, they walked more, they did more things because they did not have cars, they did not have all these things. Calories. So we'll talk about calories. Calorie counting, it doesn't matter what you eat actually. You can eat anything as long as you keep the calorie count below a certain number. Because it's all about energy in, energy expenditure. And one thing I also tell young people is check the weight. Every day, check the child's weight. At least once a week, I should say. You should not know the child's weight only when they see the physician's office. Regularly, if you're worried that your children are becoming overweight or obese, check their weight periodically. And of course, we always say limit the screen time in video games. And also, I try not to tell children, oh, they have to go to the gym or this and that, because it's hard to get that motivation to go. So we say it was passive exercise. So maybe on their phone, you put one of those 10,000 apps, 10,000 step apps, and try to get 10,000 steps. Additionally, I try to encourage young people not to eat their meals after 7 p.m. After 7 p.m. is when your body starts to wind down. And you have an issue, you have a problem, and of course you have to keep trying. And we talk about calories, so it all depends on the age. And so calorie counting is important for how we determine what the children are doing from sedentary children versus moderately active.
So who is at risk for back pain? You have poor posture, including students and kids who are, and as we were talking about video games where, kids are always sitting and have poor posture. And who are not physically active will have back problems, and overweight, poor lifting techniques, if obviously there's an accident or injury, with age and with family history of arthritis and cancer, smoking is also a big risk factor for back problems. What are the types of back pain? We see acute back pain and chronic back pain. Acute is when you have a fall or there's an injury and you have the pain that lasts only for less than 3 months. But chronic pain is something that stays with you, whether it's with arthritis or with the regular pain that you have degenerative joint disease or degenerative disc disease, and that turns to be chronic pain, which is more than 3 months.
Is not functioning properly, and if it is producing less amount of hormone, then we call it hypothyroidism. If thyroid becomes overactive, becomes like anxious person and then just producing too much thyroid hormone, we call it hyperthyroidism. And sometimes the thyroid tissue can develop some increased masses, like we call them nodules, and then the thyroid can go like really increase in size. We call that goiter. And rarely cancer can develop in the thyroid tissue also. So those are the 4 common problems that can go wrong with your thyroid. Hopefully it's rare, but nowadays the incidence of hypothyroidism is increasing a lot. Even in Indians, I don't know, like 25% of my family members are on thyroid medicine, and I see the trend going up in general community also a lot. So with the hypothyroidism, many times it's like, many people don't
Pneumonia is nothing but an infection deep inside the lung. Bronchitis is superficial infection. So it may cause with viruses, bacteria, and most common symptoms are cough, fever. Everybody needs to have a temperature obviously at home, and they are having difficulty breathing along with pain during breathing, increasing heart rate and shaking chills. These are the severe symptoms of pneumonia. They need an immediate chest x-ray and antibiotics. If we avoid these things, it may go into acute respiratory failure, and you may end up in hospital for oxygen, and it may complicate through sepsis. I'm going to go talk to regarding sepsis soon. So if you don't avoid this, after 3 days of antibiotics, if the pneumonia is not clearing, you need IV antibiotics. Oral antibiotics have good coverage for the entire body, but IV antibiotics go deep into the lungs and clear the infection. Sometimes the pneumonia can be one lung, both the lungs. Depending upon that, your oxygen requirement, you may need oxygenation, and also you may need some deep breathing techniques with the nebulization, albuterol, different medications. You may need some steroids also. If this thing doesn't work, you may end up in a ventilator. So the early you get chest X-ray and the early you start antibiotics and inhalers, the better you prevent hospitalization. So right now there are different types of pneumonia: bacterial pneumonia and COVID, which is a viral pneumonia. I can happily say right now that nobody should be afraid of COVID.
Thank you.
Because we have tons of extensive research was done, and we have tons of treatment options depending upon the illness of the patient. So if a patient has COVID, everybody needs to have a COVID test in the house. Just like you have a thermometer and everything, everybody needs to have a COVID test and also a pulse oximeter. Those will help us to diagnose early diagnosis, either early treatment and prevent hospitalization. Those are the important things. So if you see the pathogenesis of COVID, when you get COVID, the viral replication happens in the body, and it will cause mild illness in your bathroom. Check your waist circumference. Exactly, you need to measure around the nipple, around the belly button, horizontally. Make sure you write that number. Next 2 months or 3 months, whenever you check, if it is increasing, something is wrong. Whether you're having obesity or whether you're having any kind of tumors in the body or something, it's a simple screening technique. We tell our patients just to monitor your weight and to monitor what else is going on. What happens in heart failure? Shortness of breath, leg swellings. You can push on the legs for 2 seconds or 3 seconds and you'll see these indentations. And
either directly or indirectly. The complications valla kaniyandi. Stroke also leads to a disability. It's not going to kill a patient, but it leads to a lot of disability, like loss of function. Like patients, they are not able to do, like able to talk, able to walk, able to move. So it adds a lot of burden to families, financial burden, and then also having difficulty taking care of themselves. Like patients cannot take care of themselves. So it's very, in that way, it's a very deadly disease, right? And it's preventable, right? Approximately, a rough number, 185,000 patients every year have stroke in India. But again, this is a very only reportable cause. Patients, they all are under medication, either actively or passively, COVID valla. So lifestyle disease is another very important thing that we all can prevent, but we all lack education on that. So we think, oh, diabetes will be okay, fine. But it's very, very important to understand that. it causes long-term effects. You don't even realize, but when you realize, it's high time, and there's nothing can be done. So again, controlling blood pressure. So or identifying blood pressure. First of all, చాలా మంది blood pressure symptoms ఉండవని డాక్టర్ దగ్గరికి వెళ్ళారు. So it's very important. ఇక్కడ మన వెస్టర్న్ సిస్టమ్ లో చూస్తే ప్రైమరీ కేర్ ఫిజిషియన్స్ అపాయింట్మెంట్స్ అంటారు. Even when they have system, they don't go, but it's very important to go to a doctor, check your blood pressure. If not, $20-30 పెడితే you get a blood pressure cuff. It's the best investment, at least weekly, twice or thrice blood pressure కూర్చొని ఒక 5 minutes ఏం చేయకుండా take the blood pressure reading, అలా monitor చేసుకొని, ఒకవేళ if it is high enough, then you seek a medical attention immediately. And then blood glucose on and off, like if you don't have diabetes, maybe every 6 months to 1 year screen చేసుకోండి. Then the exercise. So doctors చెప్తారు like fine, you go and do exercise, but not many people understand what is exercise. Exercise and you can do any activity that would increase your heart rate and respiratory rate. It has to be sustained. Many patients do exercise at least 30 minutes, 3 to 4 times a week. Oh, patients will say, oh, I move my lawn, I take care of a lot of things in my lawn. Then that's not exercising. Basically, they are sitting on a lawn mower and doing things, right? So, and మా ఫ్యామిలీ ఎవరికైనా ఎక్సర్సైజ్ అని చెప్తే నేను చాలా యాక్టివ్, ఇంట్లో చాలా పనులు చేసుకుంటాను అంట. దట్ ఈస్ నాట్ ఎక్సర్సైజ్, రైట్? సో ఎక్సర్సైజ్ ఇస్ ఎనీథింగ్ దట్ షుడ్ ఇంక్రీజ్ యువర్ హార్ట్ రేట్ అండ్ రెస్పిరేటరీ రేట్. ఇఫ్ ఇట్ ఈస్ వాకింగ్, ఫైన్. ఇఫ్ ఇట్ ఈస్ టేకింగ్ అప్ స్టేర్స్, మెట్లు ఎక్కడం కానీ దిగడం కానీ, లేదంటే రన్నింగ్ కానీ, ఎనీ యాక్టివిటీ దట్ వుడ్ ఇంక్రీజ్ యువర్ హార్ట్ రేట్ అండ్ రెస్పిరేటరీ రేట్. సో ఇట్స్ ఇంపార్టెంట్. ఇక్కడ when we see a lot of peers, like నా ఏజ్ గ్రూప్ తో కంపేర్ చేసుకుంటే, like we did not have that education. ఎందుకంటే మన ఇండియన్ కల్చర్ లో ఎక్సర్సైజ్ అనేది ఇట్స్ నాట్ వెల్ స్ట్రెస్డ్ అవుట్. సో ఇట్స్ వెరీ ఇంపార్టెంట్. సో ఎక్సర్సైజ్ ఆర్ weight. These are like mostly dependent upon, like we can only offer this treatments for a certain time period of hospital care. Okay.
So what is gum disease? So as the name suggests, periodontal disease, gum disease, and any infection that in the tissues that hold the teeth. So obviously the teeth are there in the sockets in the jaw, and there's gum that covers around. And you would not believe that almost half the population has some kind of gum disease. And gums and teeth are very resilient. So when we think of something called a disease, you think, oh, I need to show some symptoms, I need to have some discomfort. But Chalasan, they are so resilient, they don't show any symptoms. It keeps happening, and you just don't realize that there's something going on. So what are the different stages? So one is gingivitis. Commercials lo chusununtaru, ads lo chusununtaru. Gingivitis is nothing but swollen gums. So it's reversible. So when you start brushing fine and you start flossing, it goes back to what it is. It goes back to health. But once you don't do that and plaque starts building up on the teeth, it progresses to periodontal disease. That's the gum disease. So periodontal disease, it spreads to the bone, it spreads to the connective tissue, and it's at a point of no return. You slowly start losing a doubt. So it does exactly. And oral bilateral pressure, it turns red in color if you're putting more pressure. So it stops you from putting more pressure. And obviously, it has that inherent mechanism that takes away plaque and everything. So definitely invest in one. It's probably the good one is like $140 a long time, and it makes a huge difference. I mean, it's what you're spending on it. You're probably going to spend a lot less paying money for cavities or extractions and things like that. And flossing. It doesn't matter how good you're brushing. If you don't floss, nothing's going to happen, because brushing only takes away from top of the teeth, side of the teeth, but it's not going in between the teeth. And the teeth are so tight, the contacts of it, bristles allowed, so you definitely have to floss. Don't use one of the floss picks, handle mein square. If your teeth are technically square blocks, that will work great, because it goes in and comes out. But your teeth are convex, they have a contour to them. So these go straight, ikkada food undipotunda, pakkan food undipotunda. So a lot of times psychologically we think we're flossing, but you're not flossing. So use a string floss where you can wrap it around the fingers, that way you can contour around your teeth. So that way you're going